one of the team members, one of the finalists have just showed up from Bangladesh, and we should probably allow them to speak. Mobile Phone Health Service Management Information System, MIS Health from Bangladesh. Sure, as long as the management has, you're taken an okay from the management.
Everybody, um, um, my name is Rashid Ahmed. I'm from Bangladesh, and my organization is Amadir Gram. Amadir Gram is our village, and the project name is Amadir Gram Breast Care E-Health Program. So the mission of our program is to reduce the mortality and morbidity from breast cancer in Khulna division by using ICT, where we estimate there are 2,000 new cases per year among 3.5 million women over age 21. And there's some scenario in the breast cancer in Bangladesh. There are 30,000 new cases each year, and Khulna division is 2,000 as our estimation, and 80% or more die, and most of the women first get expert evaluation when they have advanced in incurable disease. When the women come to our center, we found that they are like a stage in 3 or 4. So is a bad situation we found in our center. And our activities to meet the challenges for breast cancer in Khulna division. In Khulna division there are 10 districts, and Amadir Gram we are created a specialty outpatient care center to provide centralized and coordinated diagnostic and treatment facilities. And we have organized weekly telemedicine, a new case review conference with national international experts by using video conferencing facilities. And we have developed a Bangladeshi written web-based electronic medical system, record system, or EMR. Our people developed the EMR, and which is the web-based. And in our center, we thought that access for all, regardless of ability to pay. And main thing is centralized and coordinated care we're trying to provide. And we have installed a state-of-the-art breast ultrasound machine in the center to cost-effectively and immediately provide high-quality images for information and allow biopsy of suspicious tissues or mass in the center. And actually, this is the schematic diagram. The middle, you see the breast cancer center, and we organize the community activation, education, and empowerment, actually awareness program. On the left, we have a cultural program, and currently we have 4 centers in Bagharat, Joshua, Rampal, and Tungipara, and we're trying to develop more in the rural areas. And you know that in the Khulna division, there is radiation capacity. We're trying to develop a radiation capacity in Khulna division. Actually, we have started 206, but now we are in the stage that we are providing trying to good service to the rural population, particularly in the Khulna division. I think this is my last slide. Thank you for all.
So that you have an ultrasound in one of these small towns in Bangladesh where the images are analyzed somewhere else by ICT.
Actually, here in our center we have a ultrasound machine, and we can link this with the EMR system, and the EMR can be viewed by our experted consultant for services.
Sitting at a distance.
Yeah.
Who's looking at the ultrasound and interpreting it right away.
Exactly.
So the technician is performing the ultrasound in the town.
No, actually our doctor doing the ultrasound in the center.
Doctor is doing the ultrasound.
Yeah.
But one who is analyzing is somewhere else, who is a radiologist.
Yeah.
Okay, and the biopsy is done by the doctor right there.
Yeah, right, exactly.
So you would still need an MBBS doctor on field.
Yes.
To perform the ultrasound.
Yeah, sure.
But not a radiologist.
No, yeah.
So a plain MBBS can do the ultrasound, and that's what you are trying to say.
Exactly.
That's very good.
Thank you.
Last one was online with more about you had in Tripura. You had use the same model for eyes, and he is using the same model for ultrasound for the breast. Right, and optometrists need some training too. It's you train them, but there we need a doctor to perform the ultrasound. And ultrasound can be done by a technician also, need not be a doctor. But since it's a biopsy along with an ultrasound, you probably need a doctor or a surgeon. So, but it's on the same lines, similar lines. Who is sponsoring this project of yours?
Actually, International Breast Cancer Research Foundation and Ohio State University, US. They're providing fund and technical support.
So it's coming to the WHO?
It's not directly they're providing.
Direct, I say.
NIH.
To the NIH of the US. Very nice. And how are you encouraging the women to get screened?
Actually, initially it was very difficult because the word breast is difficult to pronounce in the village.
Right.
But somehow now we are organizing this drama. So in the drama we are actually discussing with the problem of the women, how we can treat it, and we are advised to go to the nearby center for services. So this way actually some of the bottleneck has been removed.
Have you implemented this project or it is still being implemented?
It's implemented.
For how long now?
It's 3 years now.
And how is the response?
It's very good response. And now we are trying to actually develop a campus where breast cancer center, and also the actually children cancer center, and also the radiation capacity. You know that the nutrition among the 15 million population, there is a radiation center. The government.
Sure, that's for the complete center, but the electronic part of it has been 3 years.
Yeah, the electronic part is 1.5 years.
1.5 years. I see. Good. Thank you.